are you?
Hi, I'm just okay.
You're just okay? All right, I'm sorry to hear that. My name's Kelly. I'm your nurse for this afternoon. Do you remember me? I was the one that got you settled in this morning when you first came up from the emergency room.
Oh yeah, I remember your blonde hair.
Oh.
Hi, Kelly.
Hi, how are you? Okay, I'm just gonna use some hand sanitizer, put on some gloves, and check your ID, and then we'll get started.
All right, thank you.
Okay, so I'm gonna just do a quick physical assessment and ask you some questions and see how we're doing. The nurse's aide was just in here. She took your vital signs. Do you remember her coming in?
Yeah.
Okay. So when she took your vital signs, your temperature was a little bit higher than what it usually is. Your heart rate was a little bit higher than what it usually is. Your respiratory rate was okay. It seemed to be creeping up a little bit. And your oxygen saturation level is within range, but that also was starting to be altered a little bit. Are you feeling all right?
No, I don't. I just feel so off. I don't feel good. I just feel like I'm getting like a little worse.
Okay, all right. Well, let's start off. I'm just going to check your ID band. Okay, Mrs. Smith. Okay, and could you verify that you are Mrs. Smith, Barbara Smith?
Yep, I'm Barbara Smith.
Okay,
That's
great.
Right.
Okay. All right, so I'm just going to start off with a quick neurological assessment. So I'm just going to ask you some pretty basic questions.
Okay.
So we just asked who you were, and you were able to answer that. Do you know where you are?
Yep, I'm at Yale New Haven Hospital.
Okay. Do you know what today is?
Yep, today is October 6th.
Okay. Do you know what day of the week it is?
Yep, it is Saturday.
Okay. Do you know who president is?
Yes, President Trump.
Okay. Can you look at the clock and tell me what time it is?
Yep, it's 7:03 p.m.
Okay. Perfect. Perfect. And do you remember why you came into the hospital?
Yeah, I've just been feeling really off and not right, and I've been with the kids for a couple of days for a long weekend, and I thought it was like maybe I was tired, and I don't know, it just doesn't feel the same. I just feel like wrong, like off.
Okay. Do you remember getting the injury to your arm?
No, I don't remember.
No? Over here.
Oh.
Do you remember?
No.
You don't? Okay.
No.
Well, you came in and you said that you were cutting vegetables, the kids were running around, you accidentally cut your arm, and you were trying to keep it clean with some hydrogen peroxide, soap and water, and keeping it covered, but you came in saying that it looked like you might have became infected. You said it looked warm and to the touch, and it just didn't feel right. You said there was some 2 out of 10 pain, so that's when you came in. Do you remember any of that?
No,
Okay.
maybe I was sleeping all day, I don't know.
Let's take a look.
Don't feel so good.
Does it hurt when I press around the ear?
Ah, yeah.
Okay. On a scale from 1 to 10, what would you say?
I mean, like a 6?
Okay. Let me just take a quick peek here. Okay. The site is a little bit more red and puffy than what it was, but I don't see it draining any fluids or... Okay, yeah. Okay, well...
Oh my gosh, yeah, that hurts.
Oh, but you don't remember?
No.
Okay.
No.
All right. So I'm going to give a quick listen to your heart, your lungs, your belly, and also check your pulses, okay?
All right.
Okay, I'm just going to go underneath your gown if that's all right.
Mm-hmm.
Okay, I'm just going to lift your gown a bit.
Mm-hmm.
Thank you. I'll try my best to keep you covered. Okay, I'll have you sit up and I'll listen to your lungs. Nice deep breaths, please. Okay, I'll have you lay back down. Just give a listen to your belly. Again, I'll try my best to keep you covered. Okay. Just going to give a little tap. just gonna palpate. Let me know if you feel any pain.
Nope.
Okay, belly's nice and soft. Okay, I'm gonna check your pulses. And we have an IV in that. And this IV's okay, no problem there? It looks
Yeah.
clean, dry, and intact, but I just wanna
Yep.
make sure that.
That feels
Okay.
fine. I didn't even feel
Alright,
it.
the rest of your skin looks just fine, just that one little area there, okay? Okay, checking your pulses down in your feet. Okay, I'm just gonna give a little pinch on your toes here, I'm just checking your capillary refill. Make sure we're perfusing the way we should be. Okay, and I'll do the same over here. Pulses feel okay. And again, I'm going to do the same thing over on this side. Check those pulses and that perfusion. Okay. All right, Ms. Smith, I'm just going to have you rest comfortably. I'm just going to give the doctor a call with some of our findings, okay? I'm just going to relate changing the vital signs, the increase in pain and swelling in the site of your wound.
Okay.
I'm just a little concerned also because you had a little bit of difficulty remembering what brought you in.
Okay.
Okay. I also noticed that you haven't voided a great deal. Do you feel like you have to go to the bathroom or void at all?
No. I don't feel like I
Okay.
have to go. No.
Okay. I saw that you had a bowel movement earlier today.
Yes.
Okay. All right. And when you do urinate, is there any pain, discomfort, irregularity? Did you notice any burning, any signs of bleeding or anything when you were voiding? Or
No.
Okay. And bowel movements, no pain or discomfort with that either?
No, not at all.
Okay. Well, I'm just a little concerned with these changes. I'm just going to notify the doctor that's covering and let them know.
Okay.
Okay? I'll be right back.
All right.
Thank you.